How long after an otoplasty can a full face and neck lift be performed? What's a good time to allow when booking facelift? Having the otoplasty first is how things worked out. For reference, my otoplasty is a mix of cartilage removal and sutures. This other real self Q&A here, titled "Can an ear fold surgery and a lower facelift be done together?" mentions that during a facelift, ears have to be pulled forward, which can stress the ears. Some surgeons suggest doing procedures separately, but most advise doing together. However, no suggested time after otoplasty before doing a full face and neck lift is mentioned.
Thank you for your question. You submitted your question without a photo, and you're asking in line with previous questions related to the timing of otoplasty with facelift, where there is also a consensus where both procedures can be done at the same time. However, in your situation, you're going to have the otoplasty first, and you want to know what is the ideal time frame between having the otoplasty and the facelift. You'd also describe that your procedure for otoplasty is going to be a mixture of cartilage removal and sutures. Well, I can certainly share with you how I would think this through from your end, understanding the healing process of otoplasty and what can transpire beyond the procedure and how it relates to facelifting surgery. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I perform otoplasty and facelifting surgery of all types for both, and I can certainly understand what the concern and confusion may be. So to begin with, when you understand what an otoplasty entails and how there could be a potential interaction with the facelifting procedure, I think that the decision will be a little bit more clear. So when you look at prominent ears, you look at the ear in thirds, in the upper, middle, and lower third. And the upper third being the area where you want to improve the antihelical fold. So that may be what you're referring to as sutures, because the antihelical fold is created with something called Mustarde sutures, which are placed from behind the ear to realign the cartilage in a way, or bend the cartilage, so that you get a nice antihelical fold. The middle third is referred to the conchal bowl, and that part is typically, in my practice, I resect, I remove a piece of cartilage, and then I suture the cartilage to the deeper tissue against the bone, so that the middle third of the ear is appropriately positioned. I think that those two parts have a relatively minimal issue when it comes to the incisions of facelifting surgery. The only place where there is an overlap is potentially the same area where the otoplasty incision is made, which is made in the crease behind the ear. The part that I think may be relevant has to do with the earlobe. Oftentimes when otoplasty is done, when I mention the thirds, well, the lower third is the earlobe, and the earlobe can be a little bit prominent. So a procedure is typically done which involves some skin removal in order to get the earlobe to come closer to the face, to the skull. And that area is an area that could potentially be affected by a facelift incision. Now, you have to also take into account that a procedure like otoplasty has some relative comparable issue as with rhinoplasty, where you're dealing with cartilage, and cartilage has memory. And there's issues that have to always be thought of in terms of the healing process. What I mean is, you want to achieve as much symmetry as is achievable within reason. And there are times when you have to do enhancements. So in terms of factoring in when to do your facelift, I would say that the stability of your ear healing is likely to be achieved by about 6 months. Now, if there is any need for enhancement, well, then you're almost resetting the clock again in order to get an improvement in an area, whether it's the antihelical fold, whether it's the middle third, the conchal ball, or even the earlobe. So enhancements have to be factored into your decision-making process. When a facelift is done, the incision is basically to lift the cheek area, and the lower part of the face is essentially either on the inside of the ear canal and an incision along the front part of the ear, as well as along the crease between the earlobe and the skin adjacent, and then the rest of the incision is carried behind the ear. Now, it depends on what kind of facelift you require. If you need a more extensive face and neck lift, well, the incision will go higher up into the crease behind the ear and then make a right turn towards the hairline and into the hairline, as is often necessary. So I think if the same surgeon is doing both procedures for you, then that surgeon should be the person to guide you as to optimal timing. I think that every surgeon who performs these procedures will essentially have a sense of knowing what is the ideal time frame to prevent variables that can be controlled and managed from becoming less predictable. And I think that certainly is important. When you get down to the reality of facelifting surgery, there should be limited, if not any significant tension on the incision. This has been a challenge for all surgeons who perform facelifts, because patients, of course, want to be, quote, tight enough, and at the same time you want to avoid any kind of widening of the scar, thickening of the scar, or distortion of the earlobe in particular, such as that is found in something called a pixie ear deformity. So the goal, of course, is to avoid those things, and that has to do a lot with the actual design and execution of the facelifting surgery, and of course at the same time maximizing the predictability and outcome of your otoplasty. So I think that essentially if everything looks like it's moving in the right direction, I think that you and your surgeon can decide that you can do it as maybe as early as 3 months after otoplasty. But I think it's important to not underestimate the importance of the healing process of the otoplasty to be good and stable, because when you think about it, if there is a need for any kind of enhancement, well, it can be also rolled in at the same time as your facelifting surgery. So I think that it's not an absolute line as it is how your otoplasty actually transpires and heals before your surgeon is comfortable with doing your facelift. So I hope that was helpful. I wish you the best of luck. Thank you for your question.